Well, good morning, everyone. And once again, welcome to another live this morning. Hope you're having a great start to your day. And we're inviting everyone to come on with us and question and answer Friday. And let's say hello to a few friends here this morning as you get your notifications. Let's see. Michael from Norland, numero uno. Janice, right up at the top. John, how are you? Madeleine, Kippawa, Quebec. Sandy, good morning. And Sandra, Aurelia, good morning. Fran from Orangeville, good morning to you. Sandy from Chilliwack, British Columbia. Rosa from Montreal. And Shelley, how are you? Rita, good morning. Wendy from London, good morning to you. Kevin, there he is from Oshawa. And Carol from Moncton, New Brunswick, how are you? Yvette, bonjour. Jude from Troy, New York. And Sandra and Gail from Saskatchewan. Diane, Thunder Bay, good morning. Keith, how are you? From the Banana Belt. April, Oshawa. Deb, good morning. Brahim. Wait. Sandy from Fergus Falls, Cherry. And Marla. And Donna from Newfoundland. Brahim. I'm laughing, Brahim, with you, not at you. Kelly, London, Ontario. Oh, Stouffville. I couldn't see. Sharon. Karen from Coldwater. Nellie. And Sharon. Maria. Ottawa. You know what, Brahim? I couldn't find that story. Please send that to me. Wanda. Catherine. Doc McEwen. How are you, Doc? Denny. Good morning to you. Lorraine. Hello from Oshawa. Carol, West Virginia. Oh, I'd love to be able to sing. Shelley. Sherwood Park. Nancy. Gores Landing. Francis. Good morning from Vaughan. And Nick from our staff. And Frida. And Marlis. How are you? Maria. Patricia. Tennessee, Adeline. And Kitty, how are you from Kelowna? Elsie from Newfoundland. Yeah, and Doc's doing great. Okay, Denise, Oakville. John, how are you? Bruno, nice to have you on. Okay, let's get to our questions. Nativity, how are you? Dale, it seems that there has been a rise in prostate cancer among younger and younger men. What's causing this? Yup. We're not winning the war on cancer because we're not talking about prevention. We're talking about detection. The only time they ever got into cancer and prevention is when they told you to quit smoking. That was prevention. I like that. But since then, it's all about detection. Prostate detection, breast cancer detection. Now, to answer your question, Dale, why so much more cancer in young men, I'll tell you why. It's the same reason that I talked about, I think it was last week, cancer rates are rising. Breast cancer rates are rising in young women at an astronomical rate. It's scary. And here's the reasons for it. It's the same reasons. One is called estrogen and the other one is called insulin, growth hormones. You need estrogen, ladies, but men, you don't. Well, you need a little bit. No, you don't. It's because what's happening in men's testosterone levels are sinking like the Titanic. And we're all exposed to those xenoestrogens. It's environmental. One is environment. We're living in a toxic soup, and you ain't getting away from it. Okay? Now, you do your thing to protect yourself, but you're not, unless you're planning on leaving this planet, you're not getting away from toxins. It's not going to happen. So just understand that. And what those toxins are doing, they're driving down testosterone levels in men, sperm levels in men, increasing estrogen in men. I've said this about 20 years ago. Men after the age of 50 got more estrogen than their wives. That's not supposed to happen. Estrogen is a growth hormone. And then you combine it with insulin, and now you got trouble. And insulin comes when you're a carboholic. It's quite simple. So lower estrogen, dim it out. Prostate, dim it out. I take dim every day. Okay? I dim out my estrogen and use flax seeds to dim it out. It's why flax seeds are on the top of my list as far as seeds go. I'm not big on, you're not a squirrel nor a chipmunk. And you don't need to put stuff away for winter like they do. Okay, you don't need to eat seeds and I mean, you can have a few. I don't care, but if you're I want you to have flax seeds, because flax seeds are full of lignans, and lignans block extra estrogen, xenoestrogens. Okay. And that's what's happening in prostate cancer. Okay, thanks, Dale. Maria, keratosis pilaris. How do you get rid of it? Well, where does it come from? Where do you get those little bumps on your skin? Leaky gut, leaky skin. Whenever your skin is just another organ. It's the one you see. But if you see that on your skin, you have to look inside. What's going on? Usually leaky gut. Patch up the leaky gut. Probiotics. Don't feed the bears. Don't give them sugar. It's amazing how skin clears up. Okay? Thanks for the question, Maria. I like oil of oregano too, because usually with keratosis, you're getting fungus, you're getting yeast. The body's trying to get rid of it. Karen, can you tell me which supplement helps with heart palpitations? Well, ordinarily, I like magnesium for heart palpitations. I like CoQ10, ubiquinol, okay? But the first one that comes to mind is magnesium, okay? And we talked about that yesterday, the different forms of magnesium. And when you see ATE at the end, magnesium glycinate, magnesium citrate, magnesium malate, okay? Those are all eights, ATE at the end, meaning they've been chelated, ready to be readily absorbed. Karen. Okay, that was Karen. Thank you, Karen. Jacques, how much Himalayan salt can one person take daily? Well, lots. Himalayan salt's good for you. Okay. It is, because it's got 84 trace minerals in it. It's real salt. Okay, so I like Himalayan salt. Yeah, you can add it to water. You can add it to your food. Salt ain't a problem, guys, okay? Because they always blame salt for what sugar has done to people. You know, salt and high blood pressure? Nah, it's sugar, my friend, not salt. Okay? Now, the only time salt can bother you is if you're dehydrated and you don't drink water. Okay? So I like, what are you suggesting, Jacques? Can one take 1 level teaspoon? Would it be too much? Absolutely not. I take more than that. I love adding salt, like good salt, guys, not sodium chloride. You really want the real salt. Okay. Thanks, Jacques. Nina. Nina has interstitial cystitis, bladder syndrome. Yeah, you and millions of other women, Nina. Now listen, this is what it is, okay? I have never seen an exception to it. It's leaky gut, leaky bladder. Cystitis often comes after repeated use of antibiotics for bladder infections. And the problem is, let me just back up a bit. The problem is a lot of doctors, they do this, and I don't agree at all. They give a person an antibiotic because they found bacteria in the urine. Listen, don't take an antibiotic if you don't need it, okay? And I know it happens, but now you're wiping out all your good bacteria. Look, here's a rule of thumb when to take an antibiotic if you got a bladder infection. Is it burning upon urination when you pee? Yeah, you're really burning. Okay. You don't want that to go up to your kidneys. Take an antibiotic. And listen, the recent research on antibiotics is you take them till the pain's gone away. And I know they always talk, they still are 50 years behind because they want you to finish those antibiotics. Look, the research is showing that. No, don't do that. Take it till your symptoms go away, and then make sure you load up on probiotics. But interstitial cystitis, a chronic condition, couple of things are happening. One, usually your progesterone is going down. 2, you have leaky gut, leaky bladder. You've got to fix, and you've got a fungal infection behind there. That cystitis is actually fungus. It's a yeast in that bladder, in behind the bladder. Get rid of it. Don't feed it. It wants sugar. And you might elevate your progesterone levels and decrease your estrogen, the extra xenoestrogens. Okay, that all helps. Okay. Drink lots of water. And hold on there. Next question. And that was Nina. Thanks, Nina. It's inflammation in the bladder. Yeah, for sure. But why? Okay, good question, by the way. Okay, Kevin, what about high-level secondary kidney disease? I do not do sugar and rarely do carbs. Well, you're on the right track, Kevin. There's nothing that will destroy your kidneys more than sugar will, because sugar destroys blood vessels. It starts with capillaries. So you're doing the right thing. Now, when you got chronic kidney disease, well, now you're in another category. Your kidneys are not working properly. Just make sure you're drinking lots of water, and certainly avoid the sugars for sure. Okay, you're doing the right thing. Now, again, I'm trying to think. What else do I do with that? Okay. Anyway, let me think about it. I gotta think about it. Okay, I talked about that, and that's Kevin. Kim, lichen sclerosis. Okay, those are patches on the skin. They can be in the privates. They can be inside the mouth. I've seen it on the tongue, inside the cheek. lichen sclerosis is autoimmune and it's fungal. It's leaky gut. Again, we come back to leaky gut. Isn't that a key thing? You bet your boots it is. What are the main seeds of disease, of all disease? Too much insulin, leaky gut, okay? Oxidation, free radical damage. Man, you can focus in on those three and you hit almost, even in autoimmune, leaky gut. Okay? And what cream to use on the skin, Kim is saying. Well, look, I like, personally, I like our Rivera because of its great antioxidant. Keep taking, Kim, your probiotics. Work inside out. Works inside out. Okay, Shelley. I took magnesium and 4 capsules of cortisol for 2 months, but still have sleep issues with waking up. What can I do? Well, Shelley, like do everything you can. One thing about sleep, and even though you're taking what I would have you take, cortisol, you're taking that. I like magnesium. You're taking that. You're still waking up, Shelley. Look, make sure your room is cold. Make sure, you might take, even though you're taking magnesium, you might want to take the Epsom salt baths. I mean, try it all, man. Are you wearing a mask over your eyes? Cool room. I can see my breath. It's so cold in our room. But it's good for you. That's the way you're supposed to sleep. But your cortisol, even though you're doing that, your cortisol may be still high, Shelley. And generally, I would ask you a question, how you feeling other than that? But make sure you continue and just sleep is very, very finicky, isn't it? Like 70, 80% of the population have trouble sleeping. But I like what you're doing. I really do. Make sure, like you're getting melatonin by whenever that sun's out. Even now, like if you get a sunny day, make sure you're getting enough sun. Now, I don't know if this is fooling around, but the name here is Cleopatra. Okay. Hi, Cleopatra. How are you? Family member had surgery for an anal fissure. What can help with the recovery? Well, probiotics. Anal fissures, by the way, they have to be differentiated between an anal fissure and hemorrhoids. Often mistaken. But if they had surgery on it, no fun under the sun, anal surgery, yikes. But probiotic, I put it right on the rectum. I put it right there on the anus. Open up a capsule with oil of oregano on a Q-tip and apply. That's what I would do. And you might have to pray a bit because that oil of oregano can be strong. But boy, is it ever effective. Incredible. Okay, Cleopatra. I don't know if that's you joking, you're trying to pull my leg, or if that's your real name, but I like it. Okay, Donna. What did Dr. Martin think about NMN? Does it actually help in anti-aging? Well, Donna, look, NMN, I call it, it has its day in the sun. Like it had its day. A year, 2 years ago, you're reading all about it like it's a miraculous anti-aging. It's the best thing since sliced bread. I'm not so sure, because I'll tell you something. I will put up the research that is done on pine bark extract against that as far as anti-aging. Look, anti-aging, lay off the sugar and you got a great anti-aging, okay? Because there's nothing that'll wrinkle up your skin more than sugar, because it glycates. It causes glycation. But guys, look it, you know, I should bring a picture up of me when I graduated. You wouldn't even recognize me. Okay. Like, I like anti-aging. I do. I don't like getting old. But are you kidding me? But nah, like NMN, I saw all the research, and good for people that like it or whatever. I put it up, don't put it up against Navitol, because nope. I tell you, the research is incredible. And I say, you want if you're going to take something, a powerful antioxidant, I've never seen anything like it, Navitol, to compare it to. So when you're asking me about that, I go, yeah, it's all right, but I like something better. Okay, that's just me. I'm consistent about that. Anyways, Pamela, can vitamin D contribute to fatty liver if someone does not have a gallbladder? No. No. You never, ever get fatty liver from fat. Fatty liver doesn't come from fat. Fatty liver comes from sugar, and especially high fructose corn syrup. Okay? If you don't have a gallbladder, vitamin D it's going to give me fatty liver. Okay? And by the way, your gallbladder, you need it. God gave you one. If you lose it, well, your bile comes from your liver, not from your gallbladder. Your gallbladder is just a reservoir, just a little pouch. And I'm not saying it's not important. It's very important. But you're still making bile, and if you're making bile, it helps to absorb your vitamin D. So no, it's never going to give you fatty liver. Okay? Now, if you listen to some physicians who know nothing about vitamin D, they'll tell you because it's a fat-soluble vitamin, you can become toxic with vitamin D. I'll tell you what, I've never seen a case. 50 years, I know why you're here. Your vitamin D is too high and you're going to die. Nope. I've never seen a case of it. Now, look, I'm not telling you to take here's research, by the way. Okay, here's research. And because they were trying to get people to become toxic with vitamin D, they you know what happened? 6 months, every day, 50,000 units of international units of vitamin D, and guess what? They developed kidney stones. Well, why would anyone do that for 6 months? But they wanted to do the research really to show that it's sort of a red herring. Like it's, you know what? They talk about it and doctors are scared skinny of vitamin D because they just don't read. The pharmaceutical companies, the only thing they'll tell you about vitamin D is it ain't no good for you. And it is good for you. You need vitamin D. Everybody needs vitamin D. And you're not going to become toxic with it. Now, like I said, you don't have to they've already done it. You don't have to take 50,000 IUs every day for 6 months. I like the vitamin D hammer, though. First sign of a cold, take 20 to 50,000 IUs for 3 days. And make sure your vitamin D is with K2. Okay. Who asked that question? Oh, that was Pamela. Hi, Pam. Okay. Connie, the cattle feed has added palmitic acid, which in turn comes through butter. Is butter still a healthy option for consumers? Yeah. You know me. Eggs, meat, and cheese. And when I say cheese, I mean butter too. Yeah, palmitic acid is a derivative of butter. It's a long chain fatty acid. It's good for you. Now they use it as, you can make soap with it. Okay. But they add it to the feed. By the way, I didn't know that. But butter is the best thing for you. God gave you vitamin K2 in butter, in cheese, and you're eating vitamin D, and you're eating vitamin A. Butter is fantastic. It's the bread that's killing you, not the butter. Okay, thank you very much. Very good question. Connie. Okay. Faye, I heard on TV about the 20,000 or 200,000 person UK study on omega-3 and how they linked it to AFib. Your thoughts? I read it. I'm not convinced. Again, it was, 200,000 people taking omega-3 and but what they didn't do, it's a survey type of thing. Okay, you take omega-3, oh yeah, okay, you're in our group. But what they don't ask them, and then, a certain percentage got AFib. So they have a direct link between omega-3 and AFib, whereas they didn't ask them, what else are you doing? Are you a smoker? Do you eat a lot of sugar? Yada, yada, yada. I mean, observational studies are look, I'm not saying you can't look at them, but their association, like people don't even remember what they ate last week, never mind what they ate 3 months ago and how much of it and whatever. I don't like those kind of studies. Here's what I know about omega-3. Okay? Omega-3, your body needs. Okay? I love omega-3. I've proven it to tens of thousands of patients over the years. Proven it to them. If you take omega-3, and I'm big on DHA omega-3, the king of the castle as far as omega-3s go, okay? Omega-3, it's a car. But there's better cars. There's ones that are, like the difference between, I don't know, a Honda and a Maserati or whatever you call it. I don't know. I mean, they're both cars, but they're different. And listen, omega-3, your body needs. Okay? And I like the long chain fatty acid omega-3 DHA because your brain's made up of it. And like I said, I've proven it to tens of thousands of people. For their eyes, for their memory, for their skin, for inflammation. I've shown them. We've lowered your CRP. What's that? Your C-reactive protein. Do you know heart disease? They're talking about AFib. One thing I found in AFib? Generally, they're low in magnesium. They're low in CoQ10. They don't eat enough steak, which, by the way, has omega-3. and fish. I have fish every day in a capsule. And again, I needed results. I used to send, I don't know how many patients with cataracts or glaucoma, or they were starting to have trouble with their eyes. Say, get on high DHA with Navitol and see what happens. And go show your optometrist or your ophthalmologist. Unbelievable. How can they say that's no good for you? They scare the living life out of you based on faulty science, in my opinion. It's the opposite. AFib and omega-3. I've never seen it. Anywho, thanks for the question. I'm glad it got me excited. Nancy, can you explain why someone who eats a very low-carb diet finds that their cholesterol, HDL, and LDL keep going down? Triglycerides are fine. Well, look, Nancy, you're unique. Okay. If you're eating low carb and cholesterol, I don't care about cholesterol. I really don't. HDL I like. LDL I like too. I want it to be high, not low. Because they're transporters of your hormones. And they help your triglycerides. But most people that go on a low carb diet find that their HDL goes up and their triglycerides go down. Okay, most people. Now you might want for HDL to get on high DHA, omega-3. That'll elevate your it'll elevate your HDL. Try that, Faye. Or Nancy, sorry, Nancy. Krista, question about the reset. Can you do it if you have unintentional weight loss issues? Dr. Martin mentioned EMC helps detox the liver, but I'm scared to lose more weight. Well, look, really, you shouldn't be losing weight if you don't need to lose weight on the reset. Why? Because you're eating more protein. You're eating more fat. So you shouldn't lose weight if you don't need to lose weight. If you need to lose weight, the reset is the best thing for you because you're getting healthy weight loss. Like most weight loss is just cutting calories. Eat less, move more. But if you don't need to lose weight, don't worry about it. Eat more protein and eat more eggs, meat, and cheese. You're eating protein. You're eating fat. It's good for you. Protein and fat are good for you when they're found in God's eating plan. Eggs, meat, dairy, cheese, not milk. Okay, somebody asked about milk. I saw it. Hold on, let me go to that. Who's asked about milk? I don't know. Someone did. I'm passing over it. Okay. Well, that was Krista, by the way. John, is it possible to take too many antioxidant supplements? Curcumin, I take it. Pine bark, I take it. Resveratrol, that's in our... we have that in our thyroid formula. Berberine, nah, I don't think you can take two. I mean, you might not need all of that, but I take a lot of that on a daily basis. I look at it, we live in a world I've talked about earlier, like we live in a toxic soup. You need antioxidants. Okay, and you can have berries and that gives you antioxidants. Coffee gives you a powerful antioxidant. Can you drink too much coffee? I guess so. But it's good for, look, I'm big on supplements if you need them. Okay, and you know me, I focus. I don't. You don't need to take 100 things. Okay, you don't need to take 100 things. But I like curcumin because it's a powerful anti-inflammatory. I like Navitol. You guys know that. That's a pine bark extract. There's nothing better, in my opinion. It's the king of the castle. So thanks for the question, John. Angie, why is it fine to use, there it is, full fat cream in her coffee? Angie can't get over that. Okay? And why full fat cream isn't bad for our triglycerides? Because it ain't. High triglycerides come from sugar, not fat. Fat don't make you fat, and fat don't elevate your triglycerides. Okay? Sugar does. Crappy carbs do. Fatty liver does. Fatty liver comes when you're a carboholic and you're eating high fructose corn syrup. That's why kids are even got fatty liver. Full fat cream, okay, is good for you. Now, I don't want you to drink a gallon of it, okay? But full fat cream is really what milk used to be. When I was a kid, milk, remember, you guys might not remember. Well, if you're my age, you'll remember. Like milk used to come and half the bottle was fat. And then the geniuses in our food industry said that fat makes you fat and fat gives you cholesterol and we better get rid of it. So guess what? Now you got, you know what I call it? Stupid milk. Not smart milk. It's stupid milk. Oh, Dr. Martin, it's skim milk. That's stupid milk. Okay? That's brainless milk. It's 2%. I said that's the size of your brain. You want fat. But guys, can I tell you? Unless you got a cow in the backyard, why are you drinking milk? You can have a little bit of cream in your coffee. Okay, but I want you drinking coffee. Okay? I'm just giving you guys, I prefer if you drink your coffee black. But make sure it's full fat cream. Then it's good for you. But I'm not, here's me. Here's what you drink. Coffee and water. Yeah. You don't need anything else. Coffee, water. Okay, I'll give you a tea. But tea ain't coffee. It's good, but it's not great like coffee is. So on the reset, okay, patients that come into my office when I was in practice, I'm going to change your fuel. Low carb, high protein and fat. I'm going to change your fuel and you watch what happens inside your body. And to do that, I need to change your drinking habits. What do you drink? Soda? Well, Dr. Martin, it's diet soda. I don't care. Stop. Juice? But it's Tropicana. I don't care. Stop drinking it. I drink those smoothies. You know, the green ones? Yeah. Well, you're not a rabbit. Why are you drinking that stuff? Stop it. Okay. Drink water and coffee. And I meant it. I said, you're doing a reset. You're going to change fuels and you're going to detox and coffee's going to help clean up your liver. You mean it, Doc, that you're actually encouraging me to drink coffee? Yes. Yes. No wonder they thought I was a quack. I meant it. I'm aiming at your liver. I'm aiming at your pancreas. I want to reset them. Part of it is what you're drinking. Okay. I guess we're going to have 2 sessions because I didn't finish all today. Okay. Guys, we love you dearly and sincerely. Okay? Dearly and sincerely. Talk to you soon.